So thanks for coming out today, David.
Yeah, Dave Newton, gastroenterologist.
Well, let's start out with a little bit of the background so that people understand. The baobab fruit that we're going to talk about a little bit, but mainly we're going to talk about fiber that comes within it, is an important part, one of our product, but in general for people's health. And so we wanted to bring David in to talk about this because you can kind of explain what where you came from and then where you're at, and we'll kind of get into those details.
Yeah, so as a gastroenterologist, I've done many postgraduate years of training and now focus on community-based gastroenterology care, so taking care of digestive diseases, inflammatory bowel disease, Crohn's disease, ulcerative colitis, diverticulitis, irritable bowel syndrome, colon cancer, those types of things. And I talk about fiber on a daily basis with my patients, and I think fiber is an important part of dietary intake in general, and I think it has a very positive impact on overall well-being.
Just starting there, I guess my main question is, because I'm not the expert in this, we created Tiiga and we use the baobab fruit, which has fiber, right? But at the end of the day, I think a lot of people still aren't aware exactly what is fiber, right? We hear about it in our diet, we hear about it in our lives, it's important. Some people say it's not. Generally, I think there's a consensus now that hopefully people agree and understand that it's really important. But I'd love to hear a definition of it.
Yeah, so fiber is a form of carbohydrate. So carbohydrate is one of the macronutrients, carbohydrates, fat, and proteins. So carbohydrates are composed of carbon, hydrogen, and oxygen in various forms and chains. Fiber is non-digestible forms of carbohydrate. And when we say non-digestible, we'll be more specific, not digestible by intestinal enzymes. The official diagnosis says it has to have 3 to 10 or more monomeric units to be considered a fiber, right? So that's the overall definition of fiber. It is a non-digestible carbohydrate.
Got it. And so let's give it right away to start out, kind of give some context. Give an example of a digestible carbohydrate that people can think of, and then maybe just the non-digestible right away, just to kind of give them the context.
Yeah, so sugars, so glucose, fructose, lactose, galactose, those types of things are digestible carbohydrates. Okay, so quick forms of energy. Then you've got starches that are more kind of longer forms of energy, or longer term sources of energy. Those are digestible carbohydrates. So non-digestible, when you think of fiber, you think of psyllium husk, you think of wheat bran, those types of things would be consumed but not digested by the intestinal enzymes.
I guess my next thing is, but why is it important? What makes fiber so important that we need to consume a specific amount of it?
Yeah, you can just look kind of the westernization of our diets in developed countries, where the Western diet is historically lower in fiber than diets previously, and so our diet intake has gone down. We see rates of heart disease, cancer, things like that go up. Fiber serves multiple roles. It aids in appetite suppression. It's been associated with decreased risks of cancers and heart disease and diabetes and strokes and those types of things. It serves an important role in a well-balanced diet to help with gut health and support the gut microbiome, so all the bacteria that live in your colon, supporting overall health. So it's an important part of a well-balanced diet that I don't think we get enough of in general.
I guess the Western diet, what made it to where we don't consume fiber the same way? The example that I have is that with the baobab fruit, there's a tribe called the Hazdas tribe in Africa that's one of the last hunter-gatherer tribes, but they also eat a lot of tubers, and then they eat a lot of baobab fruit, as well as I think just roots in general. And they have one of the most diverse microbiomes, but also they just consume a ton of fiber itself, and so overall they seem to have just a higher fiber diet. And I don't know if that makes them necessarily healthier. They have a more diverse microbiome. Explain the transition away from fiber.
Yeah, I mean, the big difference is processing of food. So the Western diet is one of highly processed foods with, they're made in factories. The people that you're talking about are eating fresh fruit from the tree, right? We're not eating fresh fruit from the tree. We're not eating fresh grains from the fields. We're getting processed granola bars and energy bars and pizza and pasta and all those good things that we like to eat, but they're devoid of a lot of the other nutrients and the fiber content that I think would be beneficial. So that's the big difference, I think, that has led to the decreased fiber intake.
So our product, right, it's got over 3 grams of fiber. And so as you consume our product and you let the drink sit, the liquid starts to settle, right? And that's the baobab and the fiber settling to the bottom. We have a lot of people always ask, why does it settle? And I feel like in the Western diet as well, there's been an aesthetic side of it that do we just get accustomed to not having things because would fiber change the way that a granola bar would be if you kept all the fiber within it somehow? Or is it just not possible within the processing of food?
You could make a product that's got fiber supplementation to it that doesn't have sediment at the bottom, right?
Yeah.
If you have a So you have a soluble fiber that's not viscous. It's going to integrate completely into the product. So I don't think that it's purely just aesthetics. I think for the Western diet, it's simplicity. I've got 3 kids, and they're hooked on the quick snacks. They don't want a banana or an apple. They want a granola bar that's full of high fructose corn syrup and other additives that stimulate that.
Well, this brings up an interesting one that we sampled all over the country, and I think that fiber has always had this weird connotation of making you go to the bathroom. And it was really interesting because we'd hear people talk about eating a Fiber One bar. Like, so our product, we'd be selling it at a running event or something. Like, oh no, I don't want to eat a bunch of fiber and then go to the bathroom during the running event. And somehow it was associated with the Fiber One bar. A lot of times people had consumed a bunch of it. And it did have about 9 grams of fiber. And so is that a symptom of the actual fiber that was probably in that product, or the amount of fiber that they hadn't had and then were having all of a sudden? Like, was that from anywhere? How did that ever come about?
So the GI distress specifically related to that?
That's a great way to describe it. So like, what is GI distress and how does that come about? Because I've never even heard that term.
We could talk for 16 hours on fiber and the different characteristics of fiber that will impact the GI tract and digestion in different ways. And they're going to be tolerated in different ways too. I mean, one thing we know that if I recommend somebody increase their fiber intake and I recommend a supplement of fiber because they're not getting enough through their natural diet, the biggest complaint I'm going to get is GI distress or bloating and gas and maybe a change in their bowel habits, right? What we know is that if you slowly work your way up and slowly increase the amount of fiber that you're taking in, those side effects are much better tolerated. So I think a lot of with products like that where you've got 9 grams of fiber and daily recommended dose is 30 to 35 grams of fiber, you're getting a third of your fiber in a granola bar that takes you 15 seconds to eat, and they're good, so you often need a couple of them, right?
So you're going 40 grams.
You're going 40 grams, but you're overwhelming your system with fibers. So that would be my suspicion. I mean, there's some processing that's done with any mass-produced product as well. I don't know the specifics with that product, but I think to me it's probably the bulk increase in fiber in one setting that probably causes the most issue.
Is there a buildup that you guys kind of recommend? Because in general, I don't think people consume close to 30 grams of fiber. Like I assume, what do you normally see?
Probably 10, 15 if we're lucky. I mean, a lot of times it's even less than that. It really just depends how much natural food you're eating, because you're not eating natural food. The majority of food isn't supplemented with fiber. So
you're at 10. What did you recommend? Just add a little bit every day, every week. Kind of how quick does the body respond to this?
So if you're, and I think you can lump or group this into 2 separate people. So if you came to me and you're not having any issues whatsoever, and you said, hey, I want to increase the fiber in my diet, I would recommend slowly increasing the amount of fiber you get from natural foods, right? So fruits, vegetables, grains, things like that, and slowly work your way up. Just adding things on. I think the risk of distress from that's going to be a lot lower than if you just threw in a bunch of supplementation. In the patients that I see, they've got, they've either got diarrhea, or they've got constipation, or they've got irritable bowel syndrome, and you talk to them about their diet and they're not getting a ton of fiber in their diet, or I think that they would benefit from some sort of supplementation. I'll start them slow. Typically what I'll talk to folks about is adding something like psyllium husk, which I think is a good option for fiber supplementation. And I start with a teaspoon at night, mix it in water, drink it before you go to bed. If you tolerate that after a week and it's not quite giving you the results that you want, you take another dose in the morning and just work your way up that way, so that you're not going, if you threw in 5 teaspoons at night before you went to bed, I think you're going to have a higher chance of having more distress with it, and you're not going to continue it. So you got to start slow and work your way up.
Just multiple different ways to think of the different types of fibers, correct?
Correct. Yeah, I mean, the FDA specified between soluble and insoluble fiber. And so that is purely just talking about the extent at which fiber can dissolve in water. I think that's an important factor. The next factor is viscosity. So the amount that it is going to hold that water and kind of thicken the fluid up, right? So that'd be more of a viscous product.
So the difference between soluble, insoluble, and viscosity is still this completely separate ideas. Okay, because like in my mind, I think of is solubility versus insoluble. So insoluble, I feel like it doesn't mix with water. And soluble, I feel like mixes with water. But then that means to me, anything that's soluble would have a higher viscosity because it would mix with the water, and insoluble would have a lower viscosity. Is that correct or incorrect?
I would think viscosity in the form like gel forming.
Got it. Okay.
Right? So if you took psyllium husk and mixed it in water, if you don't drink it right away and you stir it up, it's going to become thick. It's going to form almost a gel, right? So that's going to be a viscous form of fiber. Whereas there's other.
But it's still considered soluble.
It's still considered soluble. Whereas wheat dextrin, which is a product that you can get over the counter as a fiber supplement, is soluble, but it is not viscous. And so that's going to dissolve more completely in water than, say, something like psyllium husk.
So then in those cases, the way that it interacts within your body would also be different, I would assume, right? Would you recommend a psyllium husk over a wheat dextrin on the case of that viscosity? Or does it just depend on the case of that person?
I think there's roles for viscous and non-viscous. And this is where it's, fiber from natural sources they're not going to break that down and tell you. You're not going to read a label and say, okay, this product here, which has natural ingredients, is going to be high in psyllium husk, right? Because they're not going to break it down. It's going to be fibers, whether they're soluble and insoluble. Some of those are going to be viscous, some of them are going to be not viscous, some are going to be fermentable, some are going to be inert, that type of thing. So when you supplement with something, and I think there's, when it comes to cholesterol, decreasing cholesterol, helping with glycemic control in diabetics and pre-diabetics, appetite suppression, and then improving kind of bowel regularity. I think that's where the viscosity really plays a role, fiber supplementation.
Yeah, just thinking about what viscosity could do and then going through your body. I mean, that's the kind of visual that helps me. The idea of like high fiber in a bar and then the psyllium husk being the other one that like people have always associated with, like, going to the doctor and being like, hey, you need more to go to the bathroom, one way or the other, right, from the diarrhea. So I actually do really want to understand this. Diarrhea versus constipation, can they be from the same diet?
You can. I mean, there's a bunch of different reasons for somebody to have diarrhea and somebody to have constipation. I mean, there's
it's endless.
Tons of different, whether it's pathologic diseases, whether it's inflammatory bowel disease, whether it's irritable bowel syndrome. And there's different, you could talk for days as well on that, as different causes of diarrhea and constipation. Food malabsorption, so somebody that's lactose intolerant, can't digest lactose is going to have diarrhea because they have lactose intolerance. So completely different than somebody that's got inflammatory bowel disease and diarrhea.
Does fiber help if you're lactose intolerant?
It may help to absorb some of the extra water that's in the GI tract, but it's not going to treat lactose intolerance. Right. So we have somebody that's lactose intolerant. You recommend avoidance of lactose-containing foods.
Yep. Or
you can supplement with the widely available enzyme lactase that breaks down the lactose and can allow you to ingest those things.
Yeah, because I'm lactose intolerant, so I've always, having drank more Tiiga than just Baobab, it's like weird. My stomach from the Baobab fruit, I feel like it's helped it a ton, but I'm not, those are correlation, not causation, right? But it's like the idea, I didn't know if that was actually a thing where potentially if you did consume more fiber, it could offset the cramping or the issues, but...
I don't know if there's been a good study on that.
No, I highly doubt that.
I could assume it could probably help with some of the increased fluid that's in the colon, and that's... When I see somebody that's where there's kind of this misconception with fiber, right? If you take fiber, you're going to have diarrhea, right? It's a misconception. You're going to have GI distress, right? If you've got viscous fiber that goes through the GI tract and holds water, right? So if you have somebody that's constipated and they drink enough water, you're going to bulk up the stools and it's going to help with constipation. If you've got somebody that's got diarrhea, which doesn't take that significant of an increase in fluid content to the stool, if you add a viscous fiber to that's going to improve diarrhea. So it's going to absorb that extra water, it's going to bulk the stools. So that's where I think these highly viscous fibers with viscosity, such as psyllium, I think that's where their benefit really lies, to really regulate those stools. And I think getting over that misconception with patients, right, and talking to somebody with diarrhea and saying, hey, you need to maybe get a little bit more fiber in your diet.
We're at farmers markets, we're in grocery stores. We'll be there and just talking to people, and we bring up the idea, and we usually don't lead with fiber because I think this is the conception, by everybody, right? What do they say? Like, what are some of the comments when you're like, hey, you need to probably increase your fiber to help with your diarrhea or your constipation?
Yeah, I mean, there's a lot of people that have misconceptions that, psyllium husk and Miralax or polyethylene glycol are the same thing. It's like, whereas polyethylene glycol is only used to treat constipation, it's a laxative, right? So it's only going to treat people who are constipated. So they think, oh, well, I have diarrhea. I don't want to take something that's going to loosen my stools even more. So it's really just not pushback, but just kind of questions. And so when I explain the pathophysiology and the rationale behind that type of supplementation, then they usually get on board and give it a try, and it will often fix and improve their symptoms. So
yeah, the laxative. Explain that really quick, because tons of people take laxatives. What is happening? Like, what is that laxative doing versus what fiber is doing within the system?
Yeah, I mean, so there's tons of different laxatives. I mean, there's stimulant laxatives that actually stimulate bowel function, and there's different medications that can actually increase water secretion into the GI tract. So if that's the issue, then it increases water secretion. There's some that just move through as kind of an inert process and osmotically laxatives pull things through. So you think like magnesium citrate. So it's not absorbed by the GI tract, and so it just goes in and it pulls everything with it and causes a laxative effect.
In that case, it's like producing a laxative effect, but it's different than a insoluble fiber running through the system. Can you explain how those two would work different?
Yeah, so what's interesting in recent research have shown insoluble fibers. If you're going to have a fiber that's going to cause diarrhea, it's an insoluble fiber. And it's usually based on particle size. So if you've got larger particles of wheat bran that's not insoluble, so that's an insoluble fiber goes through, and it's actually an irritant. And it works in a similar fashion to some of these laxatives. So it's an irritant to the colonic wall that then increases mucus production, increases fluid secretion into the colon, and then leads to looser stools. They actually did a study, this paper I just read did a study looking at plastic particles, so inert plastic particles, the exact same size and makeup as this coarse wheat bran, had the exact same effect. So it's more of a mechanical effect in that case than it is the actual.
It's like a foreign substance almost running through
what it is. It is. I'm doing some research to get ready to talk to you, and I'm looking at different products online, and they're talking about, oh well, this specific fiber, does this. It's like, well, I've got a paper here that looked at all of this other data that says none of these claims are true, right? There's only certain fibers that are going to have benefits as far as cholesterol lowering and things like that. So there's just not good randomized controlled trials, and there's not enough money into it that anybody's going to support randomized controlled trials to look at and compare, the major over-the-counter fiber supplements. So you can make a lot of claims.
Well, and I think that's why this setting is important for me, is for people, one, like I said, we sell a product that has fiber in it. Mm-hmm. I've been consuming products my entire life with fiber in it. And I still would prefer to take my information from somebody that's literally in it every day, right? As much as that company or the group might have studied it or read some papers, like I feel like people that are in it every day, the doctors that are dealing with the patients, have, one, you're not necessarily always researching these, but when you do take the time to look at them, you go, okay, no, yes. And I think you're taking each one with a grain of salt, but it's really interesting to hear from your perspective. So on this subject, I kind of want to go into more of the types of fibers, because now I'm starting to understand the soluble, insoluble. I'm starting to get the idea of the viscosity and how that can affect going through the system. But then there's all sorts of fibers. Can you explain a few of them? You don't have to go into all of them. I think we had a few that we kind of wanted to touch on.
So we've got the solubility, the viscosity, and the last kind of component characteristic of fiber is fermentability, right? So does it get fermented by bacteria, the bugs that are living in your GI tract, right? And so that's another characteristic that then can impact health effects or with the fiber supplement. So
where is it getting fermented in the process?
In the colon, generally, because that's where the majority of bacteria live in the GI tract, is further along in the GI tract. And so a lot of the characteristics, so something that's going to be fermented earlier in the GI tract and earlier in the colon can potentially cause more GI distress. If it's fermented earlier in the GI tract, because when you get fermented, you produce gas, right? Mm-hmm. If it's fermented earlier in the GI tract, you may lose some of that bowel regularity effect. So if it's more exposed, it's got to be in the stool, in the colon, throughout the length of it to really cause the motility effects to a significant extent. But at the same time, the fermentability aids in prebiotics, right? So feeding the good bacteria and promoting a healthy microbiome in your GI tract is a big part of the fermentability to it.
And that's happening in the colon, even for that?
Correct.
Okay.
Yeah, if something's fermentable, I mean, it's going to be used. The bacteria in your colon use whatever's in there for food, and fibers are a great source of food. At least a lot of the more fermentable fibers anyway. Okay,
so you have the soluble fibers, the insoluble fibers, and then, but there's still, that's the two categories, right? But then within that, there'll be more viscosity, less viscosity, and then they'll be fermented. Those are generally the prebiotics?
Yeah, the ones that are going to be fermented are going to be served more as a prebiotic, because it's going to be a food for the bacteria.
Which one's going to affect the gas the most, I guess? It sounds like from this, the ones that are going to be fermented more that create a prebiotic have the potential to affect your bowels in the system a little bit differently from a gas perspective, or is fermenting, I guess I think of fermenting as bubbling, right?
No, that's exactly right. So the fermentability is going to be what produces the gas, but I'd say take that with a grain of salt, because somebody may be complaining of gas, and it may be a symptom of something, right? It may just be fullness that you experience because you had a high fiber meal. It slowed down the emptying of the stomach. It provides this fullness feeling. So when somebody comes to me and say they have gas or bloating, well, is it truly related to gas production, or is it going to be one of the many other factors? But the gas production is going to be the fermentable fibers are the ones that are going to ultimately produce increased gas. And if you look at natural foods, right? So the natural fresh fruits and vegetables and foods like that, where they don't break it down and say, okay, there's this fiber, there's this fiber, there's this fiber. There's going to be varying degrees of fermentability based on what you eat. And so we won't go into this too much, but there's something called foods that are high in FODMAPs, or highly fermentable foods.
I do know FODMAPs.
Yeah, so FODMAPs are types of foods and carbohydrates that are associated with increased GI distress, and we know that if we go on a low FODMAP diet in somebody with irritable bowel syndrome, that they can have improvement of their symptoms. We'll use our dietitians for that to help with that guidance.
So that leads to a question of, if you have issues and you need to use the FODMAP system, so you're more gassy and you're trying to eliminate those foods, which are potentially also high in fiber, is that usually when you start to talk to people about supplementing with specific type of fiber at that point, or are they able to still find fibrous foods within whole foods?
Yeah, I typically do both things at the same time. I talk about fiber supplementation. A lot of it, though, the fiber supplementation is going to be, I'll go to that earlier if they've got bowel irregularity, or if bowel complaints are a major part of it. If it's just kind of that, I eat and then I feel crampy and gassy, then I think you focus on the food intake, and avoiding trigger foods and things like that. But it's more, each patient's going to be individualized. But if somebody comes in and they says, eat something, I get crampy pain, and then I have diarrhea, well, you figure out what that trigger food is if you can. If you can't identify a specific trigger, then you go to things like FODMAPs and try to better identify it that way. At the same time as that, I'm saying, okay, well, how about we throw in a little bit of fiber supplement to see if that helps ease things through. And a lot of irritable bowel syndrome symptoms are related to visceral hypersensitivity, so that the gut is not, your gut responds differently than mine. There's a big nervous system called the enteric nervous system, and if the intestines stretch, my body reacts differently than your body. And so somebody with irritable bowel syndrome has more hypersensitivity, so they have more symptoms related to normal stretch than what somebody else who doesn't have, right? And so your goal there is twofold. You want to treat the hypersensitivity, one, and then two, you want to decrease, you want to do what you can to decrease the stretch, the irritation of the bowel, right? To reduce that risk anyway.
Is there generally things that cause IBS that are pretty solvable?
That's a good question.
It seems broad, right? Like IBS to me seems very broad. It's super common,
super common,
but it can also show itself in a lot of different ways, correct?
Yeah, I think the typical, I'll have somebody that shows up today who 6 months ago had norovirus, right? So they had norovirus 6 months ago. They recovered from that, but ever since that time, they've had persistent, they eat, they get crampy, they get diarrhea. So we would define that as the post-infectious irritable bowel syndrome, right? So you can have infectious triggers, you can have dysbiosis, so alteration of the microbiome. There's just a whole host of different things. It's not one specific thing causes irritable bowel. There's just a bunch of different, and we don't have a test for it, right? There's not a specific test.
So yeah, how do you even finally figure out or decide that they have IBS?
Yeah, it's criteria, and we won't go to the specifics of the criteria, but in general, it's kind of some sort of abdominal distress, right? So whether it's pain, gas, cramping, that is improved, that's associated with a change in bowel habits, that is improved with evacuation of the bowels. So I eat, I have pain, I go to the bathroom, my pain goes away, is kind of the typical pattern. And you're going to rule out based on kind of their demographics and other things that they tell you, and you say, okay, well, I'm going to test for celiac disease, or I'm going to test for thyroid disease. I'm going to look for inflammatory bowel disease, a whole host of different things that you go through. If somebody comes in and they've got zero risk factors, they don't have any red flag symptoms, you really target pretty quickly treatments for irritable bowel.
I just feel like there's a lot of people that have irritable bowel syndrome.
Yeah.
Like it's got to be a crazy amount.
Yeah, but I'd say there's people that consume, a food a diet that's highly processed all the time.
So the people that have IBS, it's like, oh no, is it almost like keeling over, like in serious pain, then the bathroom happens?
No, it doesn't have to be.
Or sometimes they're just uncomfortable all day.
And they changed the criteria a couple of years ago. It used to be, I think it used to be just pain. It had to be pain. And now it's any gas, bloat, anything. So anybody that's got a little...
Broaden it out.
Yeah, broaden it out. And so you increase the number of people that would kind of be diagnosed with irritable bowel syndrome.
Got it.
Just incredibly common. But yeah, a lot of it's diet related, right? A lot of the stuff we go through. I mean, a lot of my day is spent talking about diet, whether it's they have inflammatory bowel disease, which is treated completely different, or they have irritable bowel syndrome. We know that diet plays a big role in both of those conditions.
I don't think we talked about this yet. What inflammatory bowel disease? Can you
Yes,
go into a little bit of it?
Crohn's and ulcerative colitis.
Yes, go into these, please, because I do want to understand this.
So those are inflammation of the GI tract. So Crohn's can affect anywhere from the mouth to the anus of the entire GI tract. And you can have extra intestinal manifestations. You can have arthritis, you can have rashes, you can have eye issues, things like that. Ulcerative colitis is confined purely to the colon. So it's 100% the colon. They are not they're closely related. They're not 100% identical. They're treated, a lot of times they're treated the same, and we use strong immunosuppressant medications to do that. So anti-TNF agents have kind of been the mainstay for anti-inflammatory agents in inflammatory bowel disease. And
then Crohn's can be curbed through diet, or no? It can help it, but it comes on. Yeah. I've known a few people that have Crohn's, and it's like, it seems like they manage it. Some can manage it really well. It seems hard no matter what, but it can also just flare up pretty sudden.
We'll have people that want to, control their disease with diet, and you try to partner with them because it needs to be shared decision making, right? Mm-hmm. But I tell them, I say you've got severe disease, you've got a chronic disease, a lifelong disease that in a lot of cases is going to be progressive. The best approach is to get it under good control early on. I don't think that's going to happen with diet alone. Now, you're probably going to have people that say, okay, I got my Crohn's controlled 100% with diet. I'm not saying it can't happen, but the majority of cases, you're not going to do that with diet alone. You're going to have strong medications that are going to control the inflammation if you want to supplement with a dietary focus. And that's, anti-inflammatory diets, Mediterranean diets that are low in processed food, the same stuff that we've been talking about.
Yeah.
Kind of more natural food diets.
But
but completely different game. But at the same time, there's some studies that show supplementation with a viscous soluble fiber can improve bowel frequency in Crohn's and ulcerative colitis, which there's no reason it's not going to work in that situation. But it's not going to treat the inflammation. It's just going to treat.
Yeah, that's what I was thinking about.
Treat the symptoms more than anything else.
That's where that's where medications would kind of come in.
Yeah, and you need to treat the inflammation because if untreated or poorly treated ulcerative colitis increases your risk of colon cancer. So you want to treat those things. You want to treat that inflammation if inflammation is present. And so that's why if somebody comes to see me, they've got symptoms that I think are most typical for irritable bowel syndrome. They've got any red flag symptoms. So, things that a change in bowel habits, a significant change. Blood in the stool is kind of the big one. If they're losing weight, if they're waking up at night to have bowel movements, those types of things kind of trigger it a little bit to say, okay, well maybe we need to, this may still be irritable bowel, but we need to trigger it. We need to do a little more testing. Irritable bowel doesn't cause bleeding on its own. Irritable bowel typically doesn't have people wake up in the middle of the night to have bowel movements. So you're in tune with what the patients are saying, and if they've got anything that sounds a little more concerning, that you do further testing, whether it's a colonoscopy, an endoscopy, blood testing, those types of things.
I don't think that people talk about or think about their gut a lot, and then they don't think about the potential, hazards that can happen, and then they also don't get tested. It's not really a thing to get tested for any of this unless you have the problem. And, that's why, that's a big component of our product, right? In general, is the idea that you can take something that's preventative to potentially help, or just thinking about things preventatively, even from a testing standpoint. And so what are some ways to check on this, or even potentially check on it before you start having the symptoms, or do you have to have the symptoms before you can even kind of go research? What are those?
The biggest thing we do preventative wise is colon cancer screening, right? So colon cancer is incredibly common. It's the behind only breast and lung in females and lung and prostate in men, as far as.
So it's both male and female.
Male and female. So we tell people 1 in 22 men and 1 in 23 women will be diagnosed with colon cancer in their lifetime. So that's a lot of people, right? So the best thing that we can do to prevent colon cancer is colon cancer screening. There's a bunch of different screening options. The best is a colonoscopy. It's been the gold standard for years. You use a flexible camera, go into the colon, look for any precancerous polyps, and by removing those precancerous polyps, you can prevent colon cancer from occurring. That sounds really easy, right? But we screen maybe 60 to 65% of people that are eligible for screening. So our screening rates are abysmal. They're getting better. I mean, we're working on it, but they're not as good as what they should be. So if we're talking preventative care, that's kind of the big one to prevent.
Is it because people are afraid to do the test?
There's a lot of barriers to colon cancer screening. I mean, I would assume there's similar barriers to, staying up to date on mammograms and DEXA scans, so bone density testing, things like that. Colonoscopy is unique in that it requires a bowel purge, right? So you have to take a laxative to clean out your colon. It requires a procedure generally with sedation, so people need to take a day off of work, and they need to have a driver that comes with them. So those are the kind of the unique barriers to that. But we've got, there's a lot of people in, nationally and also in our community, whereas I think Lincoln's more proactive than a lot of places. But there's a lot of people even in our community that don't have primary care doctors, that aren't aware of recommendations to do preventative health care. So I think we can do better in that regard.
Yeah, I would agree. I think I finally just got a primary care doctor, by the way. So, I mean, I'm a perfect example of it's not something that you think of. I think I'm trying to do preventative care, but I also don't know what are those things. And that's why, this is one of the reasons I wanted to talk to you and have this conversation, is because you are presenting things that a lot of people aren't even just thinking about in general.
And we've talked about that before. I mean, our healthcare system is not set up for preventative care. It's, you have a problem, you go to the doctor, you get the problem addressed. And I think if we had more of a focus on preventative care and wellness and things like that, I think we'd have better outcomes. And I think we're starting to slowly shift that way.
We are. I think a lot of people are taking their health in their hands. And again, the reason why I wanted to do this, and I told you I wanted to do this, was I think that's really important when people create products and companies exist, that they don't just, we don't say we have 5 doctors backing it or whatever. We just have the conversation. And it's not that our product's the best thing ever, this product's the best thing ever. It's just like have the conversation about health, and then that makes more sense. Because if you have this component, and we're going to talk to people that don't even have a component that would, be connected to our product, because I generally am interested in preventative health or just health in general, and especially the preventative. And so it's all intertwined. You know this stuff.
Yeah.
And so where do you see that you even just try to help yourself, and then where do you find the struggle to even consume?
Yeah, I mean, my shortcomings are snacking. I mean, that's the way I've been my whole life, is just I like to snack, and we've got 3 kids, and so we're busy, and so often, after a ball game, it's easier, obviously, to pick up drive-through than it is to go home and make a meal or try to be proactive. But we've, things in the past, what has made me successful is just planning, right? You say, okay, well, this is what I'm going to do for breakfast. This is what I'm going to do for lunch, and I'm not going to deviate from it. It gets a little boring, and so eventually that doesn't work.
It maximizes its course, yeah.
And then supplement with some exercise. But I mean, if you wanted to deep dive into weight loss and evidence for weight loss, it's diet. You can't out-exercise a bad diet. And I try to tell people that, and my example to them is I say, okay, well, pick your favorite candy bar. Okay, a Snickers bar. Okay, Snickers bar is 220.
I actually know that. I think it's 220 calories, weirdly,
Yeah. How long do you got to walk or run on the treadmill to burn 220 calories, right? So it's just easier to not eat a Snickers bar, which isn't going to satisfy you for more than 15 minutes. It's, so that's the example that I give. So you try to, when I'm working with patients, and what we'll typically see where I'm talking to somebody about weight loss is non-alcoholic fatty liver disease. So fat, like it goes into your stomach or goes into your thighs, it can go into your liver, and that can cause all sorts of issues too. So when we talk to patients about weight loss, it's say, the focus is diet. Now you want to supplement with exercise because that's good for cardiovascular health. And the majority of people with fatty liver disease don't die from fatty liver disease, they die from cardiac disease because they've got diabetes and blood pressure and cholesterol. So exercise can help with cardiovascular health, but it's not going to lead to significant weight loss on its own. You got to change the diet too.
How does the fatty liver disease come about?
Excess calories get turned into fat for long-term storage, right? And just like it can go to your dad bod, it can go to your liver, and so that's
a lot more dangerous because you're not seeing that happen.
You're not seeing it, and it's like in men, visceral fat too, right? So it's the fat that's around your organs that causes the trouble. It's not the fat everywhere else. It's the visceral fat that causes issues. But fat in the liver, and there's this thought that we're under recognizing fatty liver is kind of an early sign for insulin resistance, and
it's pretty close to direct correlation to people that start to have high A1Cs and type 2.
Yeah, I mean, you can see it first, and then you can see fatty liver disease in skinny folks who don't yet have diabetes, but it's usually tied to some degree of insulin resistance. There's just insulin resistance tied to it, where the body doesn't respond to insulin the way that it should, so you have to increase the amount of insulin that you make, and that's kind of a...
Got it. And from your recommendation, will we be talking to somebody specifically?
Yeah, I mean, I think that's out of my realm, and I think it's a good thing to talk about kind of insulin resistance, prediabetes, diabetes, because I think there is... we can talk. We can jump to that too. I mean, I think there's some evidence that fiber supplementation, right? And so then I would take that secondhand to say, okay, diets that are high in fiber are going to improve glycemic response and things like that.
So for people that, I guess they've heard of a few of them, right? So most people have heard of psyllium husk, and then a lot of people, I think now, have probably heard of pectin, and then there's gums. But I want you to kind of explain the types of fibers, because I think it's important to know kind of potentially where they come from and what they are. I think that just kind of gives people an idea of how the different ways that they potentially could find fibers. And we'll probably get into, obviously, the types of fiber foods, but just like what they are.
Yeah, so you have the natural occurring fibers, right? And then you have the functional versus synthetic fibers, right? And so when we talk about functional fibers, so anything that is a fiber supplement that isn't from whole foods to be classified by the FDA as a functional fiber, it needs to have a proven health benefit to it. And so there's a short list of those fibers, and those are the ones that are used as supplements in your protein bars and the supplements that you can get over the counter for fiber supplementation. So some are synthetic that are created in a lab, some are semi-synthetic, and so that are taken from one natural occurring product but then synthesized in some way to alter the composition to make them, and change their composition in some way, and so they become a semi-synthetic fiber. And then some are natural fibers, like beta-glucan comes from oats, right? Psyllium husk is a natural that comes from blonde psyllium seed husk, whereas something like wheat dextrin is a semi-synthetic fiber that is, partially created in a lab. So that's kind of the difference in labs. And then pectin is a natural fiber that comes typically from fruits.
So in our case, like the Baobab fruit is super high in pectin, but it's a powdered fruit. So I don't know how that would affect it. I don't know, maybe because the way that it like finalizes its ripening, it's so different in the way that it ripes. Whereas I feel like say an orange, when it starts to ripen, the juices are going in which is the sugars, right? So this is me not knowing, but kind of explaining my logic, is the sugars would be going internally, right, to the juice area, and then the fiber would be working its way to the skin, because you want to eat the skins of that fruit. And I don't know, the Baobab is super unique in that sense that it's growing a hard shell, which is literally like wood, right? So, we have the fruit. Let's grab this. Like, that's hard, and then, but in that fruit, what is the composition of it? We have this here. So it's, and I'll let you read this to even make sense of it more, but it's 42% pectin.
Yeah, 42% pectin. It's, dry mass percent's 93%, so it's very dry, right? So there's not a ton of fluid content.
No, it's...
The Baobab to start with.
Yeah.
2.7% starch. It's got, 6% proteins. It's got 33% total mass of glucose, fructose, and sucrose. So it's got those simple mono and disaccharides. And then it's 42% pectin. So it's high fiber. It's almost half of the fruit itself.
There's a few different places to find the dietary fiber. So I know, like, within ours, even the first batches of Baobab that we were getting in, I think the company that we were working with, it was in the 40 to 45 range. But then we've worked with other companies where it's high as 55 or 53% fiber. It's both soluble and insoluble. So I think the soluble and pectin is soluble fiber.
Correct.
And so there is some insoluble, which I think that would bring it over the 40%, which is, like I said, it's just really unique in a fruit within the core substance of the fruit, right? We think of like oranges, and really, I guess if you eat the orange, you're still getting a large amount of fiber.
Correct.
But a lot of times we're squeezing out the juice, which is getting none of the fiber, it's just getting the sugar. So
you've got this data on the breakdown of what is in Baobab fruit. The fibers that are in natural occurring foods, it's not worth the expense in a lot of cases to break that down and figure out what exact fiber is in it, right? So you're not going to have this specific. So I can go take wheat dextrin and know that I'm taking wheat dextrin, or I can go eat, a diet rich in fruits and vegetables and not know exactly the 100% makeup of what fiber I'm getting. It's that breakdown. So I think the specific makeup of the fibers is more important in supplementation than it is in a diet that's
just high in fiber from whole foods.
And that's what's unique, I think, with Baobab, is that I don't know that anybody, I think the extent that you could go to figure out exactly what's in it and say, okay, this is this is going to be different based on, from my understanding, where it's grown, which part of Africa it's grown, and so I don't know. There's a ton of utility doing that, as far as, I think it's interesting.
We've thought about it. Like, again, this is where you go back to the cost of like doing a trial to do this. But I think kind of what you brought up, if you know it's high in fiber, you know that there's different sorts of fibers within it, it's kind of solving that part of the problem. It's not, and it wasn't like, the Baobab tree was specifically made to be psyllium husk to help your bowels.
Exactly right.
So it's really unique, and it has so many other properties to it. We had thought about it from the sense of, let's go get testing so we specifically know what's in there potentially from a claims perspective, or to make it simplified for a consumer to, understand, okay, this does this, so then this is what's in it, right? Or this is what's in it, so that's going to do this. Yeah. So that was kind of what I thought about it from. But in general, no, we were just, like I said, and I was completely ignorant to fiber. This is why we are talking about this now, like completely ignorant before we started Tiiga. And then now I've had to learn a lot about fiber, but there's so many layers to fiber. I think it's so under talked about because I think it's completely associated with going to the bathroom. And so, like, I'm telling you, like, everybody that we would talk to about it, this is the misconception. And, like, I'm not scared to talk about it from potentially that area, but all the other benefits. So that leads us to the other benefits that I do want to get into, because I think we've kind of tapped into the different types of fibers, things like that. Its overall benefits. So fiber has a ton of benefits that people don't realize exist. And so I want to go into some of those. Generally speaking, we've kind of already brought this up from a disease standpoint, and it's not completely arbitrary. There are reasons that it exists that does this. But let's go into like specifics, like, heart disease, type 2 diabetes. Why has fiber been shown? What does it do at the beginning that potentially helps the final effect of not having as high heart disease, say, or lowering your chances of heart disease? Because it's obviously a process to get there, correct?
Correct, yeah. So with heart disease, when we think of the risk factors for heart disease and cardiovascular disease, you oftentimes will lump in stroke, right? With heart attacks. By reducing blood pressure, reducing cholesterol and glucose control, and then decreasing inflammation, are kind of the postulated benefits of fiber supplementation and diets that are higher in fiber in reducing the risk of cardiovascular.
I do want to understand more, because it's a lot of stuff come out about this, about the fiber's effect on disease. So but it's not affecting the disease specifically, it's affecting that process to get to the disease, correct? And just kind of explain, how does fiber affect the diseases or disease potentials?
The soluble and viscous fibers, so that's the lipid lowering or cholesterol lowering effects are unique to the soluble and viscous, and some fibers with some degree of viscosity. And the way that has an impact on bile absorption in the distal small intestine. So bile aids in the absorption of fatty lipids. And so by reducing the absorption of fatty acids and lipids in the distal part of the small bowel, then you can subsequently decrease cholesterol. They've done some small studies that show that this is unique to the viscosity. It's got to be the viscosity component to it. You get a similar effect with glucose lowering and improved glycemic response. There's been studies that show that in individuals with prediabetes, so the improved glycemic response is more pronounced in people who have diabetes or who are pre-diabetic, as opposed to those who are euglycemic on a regular basis. And it's a similar function in the sense that it affects digestion. So if you have a soluble viscous fiber that's ingested, it decreases the rate at which macronutrients are digested and absorbed in the GI tract. It doesn't decrease the amount that's absorbed, but it decreases the rate at which they're absorbed. And by decreasing the rate at which they are absorbed, then it can affect the glycemic response.
So, because that's the idea that when we talk about just fiber in general, it's slowing the release of the glycemic response through the slowing down the absorption of macronutrients, which I think is like crazy to even think about. It's the coolest idea. Like, you could have this for everything all the time. Like, that's where fiber to me is like.
You can go further. So by decreasing the motility, it actually causes or increases something called the ileal brake in the distal terminal ileum, and which produces GLP-1, which is all these new drugs, all these new diabetes drugs are GLP-1.
So explain decreasing motility.
Yeah, so the soluble and highly viscous fibers go into the GI tract. Think of a disease state. So there's something called gastroparesis, where the stomach doesn't empty as quickly as it's supposed to.
It's kind of just sitting
there?
It
just sits in the stomach. So we tell people to avoid foods that are slow to empty, right? So liquids empty in a linear fashion. So liquids are generally fine in somebody with gastroparesis. Solid foods that are high in fat and high in fiber are going to be slower to empty from the stomach. So fiber, you flip that around and say, okay, fiber decreases gastric emptying. So you've got a soluble, highly fermentable, or highly viscous fiber, forms a gel, sits in the stomach, makes its way slower through the GI tract. And that's where, if you look at psyllium formulations that have significant health claims to say, hey, we help with cholesterol and we help with heart disease, and that's the reason why. They've got these studies to support them, decreased absorption of cholesterol forming molecules, decreased glycemic response just overall. And so those are tied to that specific type of fiber.
Yeah, you're selling. I already want to consume a bunch of fiber, and I'm literally just want to consume more fiber now.
Yeah, it's probably all psyllium husk.
I know. I feel like we're gonna change the brand completely to psyllium husk.
I'll send you this article.
No.
But here's the deal with pectin, right? So pectin's got a lot of the same characteristics that psyllium husk has. Pectin is soluble. It's got viscosity, and so. Now, are you going to get a study?
But generally, it's not been studied. That's my thing.
It hasn't, right?
Pectin hasn't been studied the way that psyllium. Because this is my thing. Is like that's where you could see that psyllium was studied because it literally it sounds clinical. It's been marketed clinically. Whereas pectin is like in all your fruits and vegetables. So people are just like, oh, I'm just getting fiber, and so it's never really caught on that same way to understand the value of pectin fibers the same way that you understand the value of psyllium husk. And is it the same? Probably not, maybe, but we don't know because nobody's really studied it.
Yeah, there's not going to be you're not going to have the funding to ever study that on a large scale basis, nor do you need to because, unless you're doing pure pectin supplementation, you're not going to need to prove that it's a functional fiber. And I believe pectin is considered a functional fiber on its own, so there's been some proven health benefit to it.
That'd be really interesting. We took all the fiber. We take all the fiber out of, say, a baobab fruit and just use that as a specific pectin fiber.
You can use the same idea, right? You've got a fiber that's got a lot of the same characteristics of psyllium, which has been studied probably most extensively and had the most proven health benefits to it. I think you've got something like pectin that's got a lot of those same characteristics that you could hypothesize that you're going to get a lot of the same health benefits by increasing pectin intake.
So I want to tap. I think we've touched on most of the things that I want to talk about, but I do want to bring up satiation, weight control, or weight loss, but kind of go into the how it can potentially help in satiation / weight loss.
Yeah, a lot of it's going to be the same thing we just talked about. So you've got those types of fiber that are, if they're viscous, they're going to form a gel-like consistency. They're going to sit in the stomach, and they're going to give you that sensation of fullness.
Does it give you the sensation of fullness? Or does that, because it seems like there's a fine line. So there's a fine line between sensation of fullness, feeling bloated, right? The idea of sensation of fullness and bloated seems to almost be the exact same thing. You just had, 3 more grams of something or whatever. It's really interesting because that's individual almost, right?
It is. No, completely right. And I believe there was a study that looked at, said, okay, the sensation after drinking a high fiber drink was a sensation of fullness, but the overall caloric intake was not decreased, right? So you feel full, but the caloric intake doesn't change. And that, all that being said, you can't just do one intervention and say, okay, I'm going to take fiber supplements 4 times a day and expect that to lead to weight loss, right? It's like everything else. So it can help with making you feel satiated. It can help with giving you that sense of fullness, but at the same time, it's not going to, on its own, improve that. And that's going to be tied again to the solubility and viscosity of the food. That's going to help with that. And so that's pectin, psyllium, beta-glucans are kind of going to be those big ones that give you that sensation of satiety. But you're right, when you talk about fullness versus bloated, you don't want to consume it and feel bloated. So that's where you start slow, work your way up in your fiber intake. And
this made me think about the idea of when to consume fiber.
So I think there's 2 ways to look at it. One is when I think fiber supplementation, and I'm talking to my patients who have GI disorders, I recommend fiber supplementation in the evening before they go to bed. And the reason for that is if you've got some side effects, you've got some bloating, you've got some gas, something like that could be attributed to the fiber supplementation, then you're more likely to sleep through it. It's not going to cause as many long-standing symptoms. It's just not going to be as irritating as somebody that takes it first thing in the morning and they go to work and they're up and they're focusing and getting distracted by maybe some rumblings in their stomach. Throughout the day, if we're looking at glycemic response, you say, okay, consume some fiber before you eat something. Because if you're going to have fiber, if you're going to have fiber in your GI tract and the aim is to blunt that glycemic response, and based on some of the small studies that are available, hey, take some fiber before you eat a carbohydrate-rich meal, maybe you're going to blunt that response. Again, that's not going to be well studied, but that would be the time that I would say, if you want to get some potential health benefits from that capacity, probably do it either right before or during that meal. Ideally, you're eating a meal that's diverse and full of high fiber natural foods anyway.
What happens if you eat it after, or you take it after?
Like how long after?
because the process has already happened.
Yeah.
So then it's on the back end of it. Where I've found, and I'm getting a continuous glucose monitor, I'm excited to kind of measure this stuff. But I'm excited to try it before I eat a meal. I'm excited to try it just on an empty stomach, just all sorts of things. I've noticed that, maybe not after the meal, but like an hour or two after the meal, I find that having, like in our case, a Tiiga, but just like fiber rich at that point seems really good from a blood sugar standpoint, but it doesn't seem to kind of correlate with having it before a meal to slow that response.
I don't have a great answer. I mean, I would think that having it after is probably, I mean, it's not going to hurt, obviously, that fiber after you eat a meal. But I don't think if you're aiming for those types of benefits, I think probably before or during ingestion of a meal is going to be the best way to go. I'll be curious to see what you find. Something like Tiiga is nice, I think, after meal because it's got that little bit of sweetness to it. It's got the viscosity, so it's filling. I feel like it's almost, it's not a dessert per se, but it's kind of got that dessert sensation to it that I think, that's where I see it. I mean, if I get a sweet tooth after I eat a meal, I can have a Tiiga and I feel better.
That was everything that I had question-wise. Again, like I said, I wanted, one, get a doctor here who knows what he's talking about, somebody that also is passionate about microbiome, gut, the entire GI tract. But like I said, it just helps to have somebody that's in the field talking to people every day. Like it was awesome to have a conversation with you about this.
Yeah, happy to be here. This was tons of fun.
All right. Well, thank you guys. Look forward to talking to you soon.